The strategic plan sets our framework for the goals and aspirations that we're going to try to achieve for the next 5 years, not only for our patients, but also for our members as being a part of the ACC.
I think the plan, the process was really incredible this time. Talking to all the different groups that are part of the college. It was amazing how all of the viewpoints sort of had places where they said some of the same things. And those were great places to start.
Increasing the relevance of the college as a CV professional home carries a lot of meaning for me. The spirit of teamwork and collaboration, leveraging all aspects of the cardiovascular care team.
The college has been an incredibly receptive place for me professionally. I've accomplished a lot. You're talking a sort of a double glass ceiling because I'm not a physician and I'm not a man. And yet, I served on the board of trustees and I've been chair of committees.
We want to be the professional home of the care team. The ACC has been advocating for us nonstop.
One of the aims is to make the clinician healthy. So we're talking about work-life balance, we're talking about physician burnout.
I feel my own strain now as a very busy general cardiologist. My wife's a pediatrician. I see her get up at 5 o'clock in the morning to do her charting from the previous day before she gets the rest of her day started. It is a very important issue that the physician or provider well-being is addressed meaningfully.
We are creating a world where innovation and knowledge optimize cardiovascular care and outcomes. When you look at delivering actionable knowledge, one of the most important things is the timeliness of that.
Our clinical trials keep coming out, almost every year, and you can't wait for 5 years to get a guideline out. And so we're working on how to make the guidelines a living document, so that as new information comes up, the guidelines are changed right there and then as quickly as possible.
We have new emphasis in the strategic plan about listening to the patient and integrating the patient into really everything we do. So developing systems of care that are equitable, of high quality, of high value really, really excites me.
It's a little less than 1 out of 100 people are born with congenital heart disease, so it's not a huge number of patients. So one of the things that the college has helped support is collaborating together. So if each hospital has 50 patients with a certain diagnosis, but you have 10 hospitals that work together, you get huge numbers of patients. And then you actually have much more significant research.
We've sort of said it needs to be a sustainable organization. What does that mean? Well, that means having a pipeline of leaders. And what does that mean in terms of what the college's commitment is going to be to nurture that? That's something new for us.
They have really been able to help channel my passion for healthcare policy like no other organization has been able to, and have really provided me the resources and the tools to help our patients ultimately in ways that I never thought were possible.
Times have been changing, healthcare has been changing, and it's time that we adapt ourselves to all the changing needs, and I think that's what the ACC is doing.